Okay, and so good evening or good afternoon, actually. We are here again with the Arkansas Public Policy Panel, our noon webinar series. We're delighted to be back with you on today. My name is Kymara Seals, and I am the Policy Director here at the Arkansas Public Policy Panel. During the legislative session, as many of you know, we had weekly webinars to keep you informed on what was happening in the legislative session. Now that we're out of the session, we're trying to continue with informative webinars to let you know what's going on, key policy issues that's happening. And we're trying to do that maybe twice a month. On today, we have an urgent matter that we need to talk about, Arkansas Medicaid and Medicaid eligibility. We have with us as our guest a friend of the panel, Loretta Alexander. Loretta, she is the Health Policy Director at Arkansas Advocates for Children and Families. She has served in this position for 5 years, having received an undergraduate degree from Henderson State University in biology and a master's degree in health service administration. Ms. Alexander has an extensive career in healthcare. Her career spans over 40 years with experience in clinical care, community program administration, research, long-term care, and policy advocacy. Quite impressive. Good evening, or I keep saying good evening. Good afternoon, Loretta. How are you?
Good afternoon, Kymara. I'm fine.
Good. Glad to have you.
Thank you for having me.
Absolutely, absolutely. Glad to have you with us today for this critically important conversation on Arkansas Medicaid. So I guess we'll jump right in and talk about Medicaid. So what's happening, and I know, as we present this, I want to say to our people who are tuned in, there is a sense of urgency around
Absolutely.
What's happening right now. There is a sense of urgency. As of now, we know it's being reported that over 70,000 Arkansans have been, kicked off or deleted or purged from the Arkansas Medicaid eligibility roll. So let's talk about that. Let's talk about why this is happening, what's going on. So, Brett, I'm gonna turn it over to you and talk to us first about, we know during the pandemic, there was a freeze. Is that right?
Well, there was I wouldn't call it, sort of a freeze. The federal government actually gave all the state Medicaid programs a 6% increase of federal funding. And as a condition of receiving that money, the states were not allowed to terminate anybody from Medicaid except for these 4 reasons: death, they moved out of state, or if they requested their case to be closed, or if they became incarcerated. So during that time, our Medicaid rolls increased to over 1 million people. And as you know, Arkansas has about 3 million people. So there's 1 out of every 3 Arkansans were actually covered by Medicaid. So from March of 2020 until April of 2023, nobody could be just terminated, even though folks' eligibility, they might have gotten a job and been ineligible, but they were able to stay on in what they called extended coverage because of the federal policy telling the states not to dismiss anybody. And that was done at the beginning of the pandemic so that people could be taken care of. They just didn't want people being kicked off and not having any way to cover those services, because so many people were getting sick at that time.
Right. So that was good. But what's happening now? We know that we are not in a COVID emergency anymore. Medicaid, my understanding is that they are updating their
Yeah,
benefits, they're updating people who are eligible and determining who's eligible and who's not eligible to
yeah,
receive benefits.
yes, they are. What they're doing is again, as part of this overall federal process, every state is required to do a redetermination of everybody on Medicaid. So,
Well, let me
as I,
ask you, let me interrupt you just for a second. Is that redetermination, is that an annual redetermination?
well, normally people have annual redeterminations, which have, DHS didn't stop doing the annual redeterminations. They just, even if people were found to be, that they would normally have not been eligible after the annual redetermination, they didn't terminate those cases. So those, not only, those folks have stayed on Medicaid, but now, the federal government actually changed the policy, changed the law a couple of months ago, saying that states could actually start terminating people again. And again, the policy was tied to the end of the public, what they call a public health emergency. And that's a federal designation by Health and Human Services to say, HHS decides to say, okay, the public health emergency started on this date. And so the programs were tied to that designation of the public health emergency. Now, yes, people were actually had their redeterminations done, but they didn't lose services. But as a part of this process, now everybody has to start, it's almost like it has to start over for everybody. And in 2021, Arkansas legislature passed a law saying that all of this has to be done in 6 months. And the federal guidelines actually allow states to take 12 months to do these redeterminations. Arkansas began sending out the notices in February, and April of 2023 was the first month that they could start closing people's cases during this redetermination process. And that's, you mentioned earlier that 72,000 people lost their coverage during that time period. And so April is just the first month that people have been, that the DHS could terminate those cases. And if you think about just the first month, over 72,000 people lost their coverage.
That's a lot, yeah.
That's a lot. And as we go forward, there's a concern that if you start now with that many people losing coverage, that's scary.
So that is very scary, and we want people to be alert and aware, and I hope people who are watching will pass this information on to family, friends, loved ones. But let's talk about how 72,000 people have been, I'm not for sure the words, but are no longer Medicaid eligible.
Well, they said they turned.
How did the redetermination happen? They got a piece of mail, and then what?
They got a piece of mail, and the mail might have said, "Send us this information back," or it might have said, "Send us a renewal form, complete a renewal form, and send it back." Or they might have requested other information to support the renewal, to say, if you changed income, or send us a bank statement or something like that to tell us exactly what's going on with you, so we can make that redetermination. And some people, the mail was returned. They just didn't get the notices.
Right.
So over 44,000 of those people that lost their coverage, according to a report that DHS released on May the 8th, and these were people that actually lost their coverage at the end of April, they failed to return the renewal form. So that means they got the letter and didn't open it and didn't send it back, or it went somewhere else and they didn't get it, and it still didn't get returned in the return mail, so it may be sitting somewhere unopened. Or to me, that would probably be the top two reasons they didn't send it back.
Right.
Then there was another 7,600 people that failed to return requested information. So let's say if they sent you some more information saying, okay, tell us more about what we need to know in order to finalize your approval, and you didn't get those forms back in, then that leaves those folks uncovered too.
Wow. Okay, so people are being dropped from the rolls. So a lot of these people don't even know, right? That
Right.
they're no longer covered. And they may find out when they go to the doctor or try to
That
get
is
prescription
that is
medication.
exactly true. When they go to the pharmacist, and we know that people need their coverage. You know,
Right,
for various reasons, they need the coverage. You know, with children, you know, they need to be covered for their child development visits, for getting immunizations, for
right,
you know, all the other things that people need to be covered for. And you know, with adults, they might have chronic illnesses like, you know, diabetes, high blood pressure, other things that they absolutely have to have medicine take
right,
for
right,
all the time. And then beyond that, if like, imagine if you get injured or something and you have to go to the emergency room and you find out when you get there that you're uncovered, that's going to be a big deal.
right, right. So once people find out they are no longer covered, can they reapply?
They can reapply, but they don't, but you know, if they're no longer covered and it has to be within, and it has been, let's say if DHS terminated your coverage over the last 30 days, they can just submit the overdue information. You know, if they just said, send us these documents back by May the 10th, and they didn't get those documents in by May the 10th, I mean, by April the 10th. And so, within, you know, the 30-day period, they got terminated at April 30th. So you have a 30-day period you have a 90-day period to submit those documents back to DHS, and they can just reinstate your eligibility if you're truly eligible. You don't have to start over. People can go and just take the information that they need to turn in. Just go ahead and turn that information in, even if it's late.
Right, right.
Before you just go and start a new application. Because if you start a new application, you're going to be at the back of the line.
Right.
You're going to be at the back of the line behind all of these folks that are possibly losing their coverage because of the COVID regulations, and the people that were normally come due. Their new renewals will become due in that month. So those folks that are starting brand new with a new application, you're going to be at the very back of that line behind all those other cases.
Right. Well, let me ask you this. I know DHS sends mail and letter, mail to people's homes. And people, there are people who move, regularly.
Yes.
Are there any other means of outreach that DHS has in place to notify people of redetermination?
Yeah, if you lost, if people get a letter saying that they've been terminated, if the renewal notice is returned to the state within 30 days after the coverage is dropped, they have to attempt the contact by phone. They have to attempt to contact that person by email, by text, or sometimes the post office will put a little sticky on the envelope saying that this person's mail address has been forwarded to whatever place that is. So yeah, they have some requirements to try to continue to contact people. Absolutely.
Okay. Well, that's what I was wanting to know. So what if, let's talk about children, because I know, within these 72,000 people, I don't know how many are children, but I know there are a lot of children who've also been purged from the rolls of eligibility. So if a parent is no longer eligible, does that mean their children are no longer eligible?
No, it does not. Parents have one category of eligibility and kids have a different category. For instance, kids are in Our Kids A, they're in Our Kids B, they're in the newborn category, they're in TEFRA category, they're in autism category. So parents are not in any of those categories. That's strictly for children, okay?
Okay.
So let's say if you were in the Our Home or Arkansas Works category, and then your income went up a little bit too high for you to be qualified anymore, because the income level for Our Home is 138% of poverty. Well, then Our Kids B goes up to 200% of poverty. So those kids may go from Our Kids A to Our Kids B. but they still will be eligible for Medicaid under the guidelines if the parent's income goes up just a little bit higher. So no, parents need to know that even if they lose their coverage, they can still, their children still may be eligible, so they need to reapply. They need to make sure that they get the information back in for their children, or they need to apply for their children.
Okay, so what about,
let me
go ahead.
One step further. You talked about how many children lost their coverage. According to the DHS report, 23,837 kids on our Kids A lost their coverage. That's the kids that are in the lowest income category in the state. Okay, our Kids B are kids of a little bit higher income, and then newborns are just every kid that's born that's if Medicaid paid for the delivery, then those children are automatically covered for a year. So again, there's 29,000 kids that lost their coverage over, in 1 month. That's too many.
That's a lot. That's big. Yeah, that's a lot. That's
alarming.
That's very alarming. And so what? Okay, so let me ask a question for clarification.
Mm-hmm.
On redetermination, when DHS sends mail, they also send mail about the children, is that right?
Well, they send the mail about,
and our parents are the one responsible for sending that back, is that correct?
Yes.
So these 23,000 children that you just said have lost their coverage, that's probably because parents or guardians didn't return the paperwork, is that right?
Absolutely, yeah. Children don't complete any paperwork for themselves. So yes, those parents, those parents did not get the information back to DHS for their children. And we also know that we're looking at the numbers of parents that were terminated. 12,906 parent caretaker relatives, folks in that category of Medicaid, lost their coverage, and another 28,000 adults in the our home category lost their coverage. So 12 and 28 is what 40,000 adults lost. 44,000 adults lost their coverage. So it's really concerning to say that you may have the parents and the kids in the household, or maybe one or the other. We don't know. We're just looking at the numbers.
Right.
I thought, at one time DHS said they were going to do, redeterminations by household, but it looks like, according to these numbers, it's really not by household. It looks like it's by actual case.
Right. So what can someone do? Tell us about the appeal process. I know there's an appeal process, but how does the appeal process work?
Absolutely. Whenever, if you think that you may still be eligible, and you just got your coverage turned off, you can call DHS. Everyone has a right to an appeal if they lose their Medicaid. So they can call DHS Medicaid program and say, I want to appeal my termination. And that's all it takes, is to file, and that's what filing an appeal is. It's just a call.
Okay.
Just call DHS and say, I want to appeal this.
So
in the letter, it doesn't, it just says you may file an appeal by calling 855-372-1084. But, if you're an average person, you have no idea what filing an appeal is.
Right.
And basically that's the language that's used. And a lot of times that's what we find, is a lot of the language is just confusing.
Right.
I was talking to some members of the Marshallese community yesterday, and they expressed to me that much of the information on the website is just confusing because of the translation is just not the way it should be for the Marshallese to understand it the way whoever translated it. Because English words and Marshallese words don't translate word for word.
Okay.
Yeah, and Spanish is the same way.
Right.
But yeah, they can call, and all they have to do is just call that number and say, I want to appeal this. Once you file an appeal, it's DHS responsibility to set up an appeal, let you talk to whoever handles appeals, and go through that process to see if you actually are eligible.
Right.
Yeah.
So when someone calls, now this question is you probably can't answer, but I'm gonna voice my concern. I've helped people navigate DHS before, and it was not a nice process.
Okay.
So my question is, if people call that number, does DHS really answer a number and take people's appeal over the phone?
Can't say for sure. I know that there's a site that one of the pages on the renewal website or on the DHS website talks about appeals, and it has a form, and it says the best way to file an appeal is online.
Okay,
Which is another problem.
that's
because
problematic. Yeah,
Everybody doesn't have a computer. A lot of
right,
people get all their online information through their cell phone.
right,
A lot of people have limited access to broadband because Arkansas is a predominantly rural state for, in terms of broadband access.
right, right,
And, and even if you get the information through your cell phone, you may not have enough data, may not be paying for enough data to sit down and fill out long forms on it, to be
right,
using it.
right.
So there's many reasons that people just don't get that information. And so they don't get it, and they're certainly not going to be able to do it online.
Yeah, yeah.
And that, to answer that question, I don't know what all is involved in the appeal process, to be, just for transparency's sake. I know that DHS says here you can do this. I've never gone through that process, so I don't know all of the steps to get that done. But I also know that DHS in their plan that they released back in January for this is called unwinding. This whole process of redeterminations is what they call their unwinding plan. So again, that's part of that language thing I was talking about. You get a letter saying, they're just unwinding, Medicaid unwinding. People don't know what unwinding is.
Right, right.
Bureaucrats and folks like me and you know what unwinding is,
Yeah,
but the average person doesn't.
right.
They have said that they actually increased the number of people to work on appeals because they expected to have more cases that people were going to appeal.
Okay, well, that's good. I hope people do appeal, because this is very alarming. And when Arkansas advocates emailed a letter out, well, just correspondence to your database, I received that letter and I read it and I thought, this is very alarming. And I had seen it in the media, but to read it, I thought, wow. So I guess my question at this point, what can we do? Or just what can the average citizen do to help in this situation? Like I said, this is a crisis.
I mean, it is.
So
the average
critical.
citizen is, if you know anybody that's on Medicaid, anybody. I mean, I'm talking about from infancy to elderly. But this affects anybody and everybody that's receiving Medicaid coverage for anything. Tell them to pay attention to all of the correspondence that comes from DHS. Make sure they open those letters as soon as they get them. Make sure they respond to that information. And if they've gotten a letter and they've let the time frame go by and it's overdue, take that information on to DHS, even though it may be overdue. Go ahead and turn in that information. Okay. The other thing is, some people, as I said, there's obviously some people that legitimately are ineligible. Yeah. Because they might have, 3 years is a long time for a lot of things to happen. Let's say you weren't working in 2020. Now you've got a good job. You might be eligible for coverage by your employer, but because you were covered by Medicaid, you didn't select the employer insurance policy when you started on that job. So now, if you get terminated by Medicaid, the employer has to let you go ahead and because that is what they call a triggering circumstance. That employer has to let you go ahead and sign up for Medicaid on the job. For the marketplace, the marketplace goes from income up to from 200% to 400%. So let's say you a little bit too high for Medicaid. The marketplace is it's under the Affordable Care Act, or what people call Obamacare. It's another option for people to get coverage. And what they can do is they can go to the federal website and sign up for marketplace insurance. and they get a tax credit, a tax credit for their premiums to help them pay down the premium so that they're not so expensive that they can't afford them. So
Right.
there are different options for people to keep their coverage, and even if they're not Medicaid eligible.
Right. Okay. That's helpful. That's helpful.
Yeah.
So I guess my kind of last question, then I want to do a call to action. But are there groups that are having community meetings or anything in the communities to lift up this issue?
Well, I can't say what's happening in the local communities. I will say that at Arkansas Advocates, we're reaching out to everybody we can, other organizations like this, us having this conversation today. Yesterday, I did a webinar for anybody that wanted to sign up for it to present this same information.
Okay.
And the recording can be found on our website, as well as our PowerPoint slides and these links to the DHS website for specific pages.
Okay.
I know that provider organizations are actually getting letters. DHS is sending letters to the doctor's offices saying this patient of yours may be going to lose their Medicaid. So the doctors, the providers, the primary care providers are getting letters from DHS saying contact your patients to tell them that they need to make sure that they have everything in place with Medicaid. Make sure they're.
Oh, that's good.
Oh,
that's
yeah.
good. That's great.
They've been doing that for probably since early 2022. So yeah, there are some efforts. There are a lot of efforts going on. It's just that we still got to double down because
Right.
Here's the thing: you don't go to the doctor, and a lot of people don't go to the doctor unless they get sick.
Right.
So
right.
it's like you didn't bother to look at that letter, and then 3 months later, when you get sick and you show up at the doctor's office, your Medicaid is no longer in place.
Right.
And that's what's going to hit a lot of people. I was talking to people at the community clinic, the community health centers, and they said that a lot of people have like 3-month follow-up visits or 6-month follow-up visits. Well, if you just went to the doctor and then you don't go back for 6 months, and then when you get there, you're going to be hit with the fact that, oh, I'm uncovered. So that's one of the other issues that we're concerned about is folks aren't going to know until they get to the doctor.
Right. So let me just give a scenario. If someone has a accident and they need, they broke their leg or something like that, and they need like medical care urgently, not just a checkup, but they need urgent care right then.
Emergency care if it's
emergency care, right? Is there a clause that can cover that where they can go back and not appeal, but submit? I know you talked about this 90-day window. Will something like that fall within that 90-day window?
Well, again, if they lost their coverage, if they're depending on the category, if they lost their coverage within 90 days, they have a 90-day window for certain categories of Medicaid. The folks in long-term care categories, they have 30 days, I think, to submit their overdue information. But some categories of coverage have a retroactive coverage.
Okay.
Take you back 30 days if you actually would have been eligible 30 days before you had this incident. They may be able to go back 30 days and pick up, cover you for 30 days retroactive to whatever day you got approved.
Okay, I got you. Right. Okay, well, this information has been very helpful. The call to action, I think, should be that everybody listening, watching, please reach out to people and tell them that this is happening. Make sure they check their mail, because I know people get mail and don't always open it.
Right.
And so make sure they open their mail. If it's been on their counter for 2-3 months, make sure they open it and that they reply. Because right now, since April, there are 72,000 Arkansans that have lost their health care coverage. That's a crisis.
That's
And
a
more
crisis.
is coming, right? More is coming.
Yeah, absolutely, because that was just April. See, the count goes every month. So we just got into the 1st of June. So now next week we should be getting a report as to how many more folks lost their coverage in May.
Wow.
And DHS has a timeline for the notices that they're sending out based on whatever different categories. They started with those categories of our kids and our home and parent, caretaker, relatives. So those were that's the first group that then they'll go to some other categories. As people in different other categories, they'll send those notices, and they are subject to lose their coverage in different months. If they don't, if they are ineligible or if they don't get that information back in. But yeah, the call to action is you talk to people in your Sunday school class, you talk to your friends, and they're about their grandmama's coverage, about, if you're a grandmama and you're raising a little kid or raising a half-grown kid, you make sure you get that back in, for those children. And, for everybody that anywhere you see them, if you see them in the grocery store, or your friends, your family members, your whoever that may be receiving Medicaid, just give them, just help them to understand the importance of responding to DHS and making sure they open that mail and get it back in and keep their coverage in place.
Thank you so much. Well, we're going to encourage people to do that. Thank you for your time today, Loretta. This has been very valuable. I hope people will, take the call to action and actually do something, make some calls. I'm going to commit to do it. I know people who are on Medicaid, and I'm going to start reaching out like right away.
And let me say one more thing,
Sure.
Kymara. We have a storytelling project for anybody that has any experience with, being on Medicaid or family members being on Medicaid or whatever, where we will sit down and talk to you about that experience and record it. And for those people, we will compensate those people for their time with a $50 gift card. So anybody that has any Medicaid experience can contact us, and we can listen to their story about being on Medicaid.
Oh, that's great. That's great.
Yeah,
So we'll take
anybody in your listening audience or that looks at this webinar, contact us, and we'll be happy to follow up with you.
Oh, great. Wait, Loretta, we have one question. Okay, hang on one second. We've got a few questions, and hang on, they've come into me and I overlooked them. Hang on one second. Okay, here's a question from someone on Facebook that sent this in. It says, what is the easiest way for someone with Medicaid to proactively check their coverage status?
Go to the,
they haven't received anything in the mail.
Go to there's a Renew Arkansas page for DHS.
Okay.
And they can call, they have a call center, and they can call those numbers on the call center page and for the call center on that page and update their information. And every county has a DHS local office.
Right.
Talk to your caseworker at your local office to verify that you're still covered.
Okay, so people can call and do that.
Yeah.
Okay, great. Thank you for that. No, one more question that came in. Are they sending letters to the dental offices as well? You talked about they were sending letters to doctors.
I'm not sure about the dentist. I will check and I will send that information to you.
Okay.
I'm not 100% sure about dentists.
Okay. Yeah. Let me know if you what you find out, and we can always post it in our Facebook, wherever they ask the question. We can always respond. So.
Okay. Yeah.
Okay. Great. Those are the only two questions that have come in. I'm double checking my two spots for questions. So thank you, Loretta, for your time, and we will, just hope people will respond and try to get these people back.
Yes.
On Medicaid coverage. So,
and and I think that people, we're going to have to do an all hands on deck. The churches, the pastors are going to have to start announcing that on Sunday mornings. People in whatever situations, the kids that are playing ball in the sports teams and stuff, because a lot of those kids get Medicaid, and when they go get their physicals and they're not covered, it's going to matter.
Yeah.
Yeah.
This is, we're in a crisis. Yeah,
Kids that get therapy services, it's gonna matter, you know?
yeah. Wow. Okay. Well, thank you so much for this information. I think this has been a good conversation, and we're trying to promote an awareness and encourage people to take action. And we hope we've been successful in that.
Yeah.
All right. Thank you to our listening audience, our viewing audience. We will be back in a couple of weeks with another Friday noon webinar. Details on that coming soon.
And I will give you an invitation. We actually will be doing another webinar before the end of June.
Okay, great. Let me know.
Too. Yeah. And we, like I say, we're trying to keep this out there as much as possible and get it out there as much as possible.
Okay, great. We'll do what we can on this side as partners to lift it up and encourage people to take action.
Absolutely.
Okay, thank you so much.
You're welcome. Thank you.
Okay, have a great weekend.
Okay.
Uh-huh.
Bye-bye.